Okay, now we're looking at the anterior lower limb, and the first muscle we can point out is based off of that tendon. It's going to be the tibialis anterior. And if we follow it up, we can see some of that muscle belly up here with the tibialis anterior. When we follow its tendon down, it'll pass through this band of connective tissue known as the extensor retinaculum, which just helps guide those tendons. All right, right here, and it'll course on the medial aspect of the foot, tibialis anterior. Move lateral. That next muscle we have is going to be extensor hallucis longus. Extensor hallucis longus, if we follow that, you can also see some of the tendons running to that hallux, that first digit, the big toe. Then moving lateral again, we're going to have extensor digitorum longus. If we follow those tendons, we can see they're all going to pass through to digits 2 through 5. And then we can't really make it out over here, but there's another muscle called fibularis tertius that's almost going to be joined with that extensor digitorum longus muscle, but we can make out some of the tendon of fibularis tertius. If we run down, we can see that tendon here going to the side of the foot. Okay, and then the last two muscles we'll make out. We find that extensor hallucis longus. We can see this small muscle belly next to it with this tendon coming off of it, also going to that big toe. And this is going to be extensor hallucis brevis. And then similarly, if we pick out those tendons for the extensor digitorum longus, deep to that, you can make out right here and here that extensor digitorum brevis. Okay. In terms of functions, going back, we'll have that tibialis anterior, which is going to help dorsiflex the foot at the ankle joint, and will also, when it contract, pull like this so that plantar aspect of the foot will go medially, so it'll help with that inversion of the foot. If we move toward that extensor hallucis longus and brevis, will help extend that big toe, that first digit, and will also contribute a bit toward that dorsiflexion. Moving over, we have the extensor digitorum longus in here. We'll extend digits 2 through 5 and also help with doing dorsiflexion. And then the extensor digitorum brevis will also be a synergist toward that extensor digitorum longus. Then lastly, we have that fibularis tertius, which is going to help evert the foot. So when it contracts pulling this way, the plantar aspect of the foot will turn toward the lateral aspect and we'll get eversion of the foot.